and welcome to What Would Larry Do? I am Dr. Ann, and I am here with Larry Hellwig this morning. Good morning, Larry.
Good morning. How we doing?
Doing good. It's
Good.
bright and early, but
Bright and early?
we
Yeah.
have our coffee. Larry bought us coffee this morning, so I'm very happy.
We're getting ready for the weekend.
Yes, we are. It's Friday morning.
This is one of the few weekends we're not working.
I know.
It's like unreal. It actually happens. There are weekends where you don't work. So
I know. And we have the ASU USC game tomorrow.
We do. And the Cardinal game on Sunday
Yeah.
against the 49ers. So, yeah, we got a lot of action this weekend.
Let's just hope they both play better than they did last weekend.
Oh, that sucked. Seriously, if you are a fan and you watched what we watched last weekend, it was just horrible.
Yeah. Yep, for sure. My
Painful.
husband was definitely yelling at the TV.
Yeah.
All right, so we're going to dive right into our topic. We're going to talk about large pores on the face, Larry.
Okay, then.
Why is this a problem?
It doesn't affect me. I don't see it as a problem. No, it actually is. It's all relative, right?
Yeah.
If you have large pores, they're going to drive you crazy. Now, if you have a large scar on your face, or you have, you need a barcode reader for your lip lines, maybe, the pores aren't the deal. But if you have large pores and you don't have all this other stuff going on, they are frustrating. And no matter what, I always say that if someone has 5 different issues on their face and you do a spectacular job treating 4 of the 5, they still have the 5th.
Yeah.
And that's what they're looking at.
Yeah.
And I think that's where pores are. I mean, for some people, it's going to be the thing.
Yes.
But for a lot of people, it's there. They don't like them. They'd like to see less of them or shrink them or something with them. But it's not the number one thing. It's just there.
Yeah, I hate my pores.
You hate your pores?
Oh, I do. I'm always doing treatments to get rid of them. So, and, of course, other people won't see them.
We do have treatments for that.
I know. I've done many of them over my time. But first, let's talk about what the heck is a pore.
It's a hole in your skin. Is it not?
Yes, it is.
Okay.
Yeah.
The skin is the largest organ of the body, and you
Yes.
have holes in it all over the place. Those would be pores.
Yep.
There might be other things. There are other holes in the skin, too. But I guess we're talking about pores.
We are. Oh, my gosh. So they secrete oil and they secrete sweat. So what most people don't realize is your skin is actually a detox organ. So it's the backup detox organ for your liver and kidneys. So it does a lot of secreting or excreting of products, and that all comes through these little pores. Also, the other type of hole or pore that's in there is for the hair follicle. So
Right.
those are the primary pores that are going to be in our skin. What causes these pores to get large, Larry?
Well, there's lots of things that can do it, and some of it is lifestyle. Just how do we, what we eat, what we put into our body,
Yes.
sun exposure,
Yes.
big one.
Yep.
Big one. I mean, if you think about, there's holes in the ozone. They're talking about that now. The ozone at one time was, a really good protection device for us, but now there are more and more holes in the ozone, and we get UVA, UVB, and UVC through those. We get them no matter what. Well, now you get more of them. And so anyone sunbathing today is just asking for trouble.
Yeah.
I mean, that's like craziness. And when people say they wear sunblock, normally what they're saying to you is, I put it on once a day.
Or it's in my makeup.
It's in my makeup, and that's going to take care of me. It's like, are you kidding? So realistically, it's helpful. It's better than doing nothing, but
Yes.
it may not be near enough to take care of the issues today.
No, so you're right. So one of the causes of large pores is loss of collagen, and damage to that skin will make them larger. One of the biggest causes is excess oil production. So excess oil production can come from genetics. So you can be secreting all of that excess oil just naturally because you're an oily person. That's one of my problems. So I have oily skin, which benefits you because you actually age better. You'll get less wrinkles and things like that, but you get really large pores, like in your T-zone, wherever you are oily, the nose. We just saw that nose picture with those large pores. Oh my gosh, I don't ever want my nose to look like that. And it creates texture in the long run, like this picture, where you just look like you have more texture issues all over your face because the pores keep getting larger and larger. So we actually have a technology in our office that we do analysis on patients with called Visia. And this is a Visia right here, where it's analyzing how many pores you have. And that's a before and after with a halo that actually shows a 60% reduction in the amount of pores that you have. And we'll talk about that technology later on. I more wanted to show that picture that when Larry does the consults in our office, and he does the analysis of your face, there's 6 different categories that the Visia rates your age on, and it will score you. So for example, if you score a 92%, that means you are better than 92% of people your age. But if you score an 8%, that's the opposite. That means you're only better than 8% of people your age, so 92% of people your age look better than you in that category. The 2 categories that are affected by pores is number 1, just pores in general, and number 2, texture. The larger pores you have, the more overall texture it creates. And when we did my Visia, pores was the area that I scored really low. Everywhere else was good, but unfortunately, genetically, I have that oily skin, so mine continue to get larger. So loss of elasticity and sun damage you can control. Large hair follicles is also going to be genetic, but that can actually be improved through hair removal if you have darker hair in certain areas. So there's ways to work on it. But if we have this excess oil production or we've had loss of elasticity, the question is, what are we going to do about these large pores now that we have them?
Well, you can live in a cave.
Wear a bag over your head?
Or a bag over your head the rest of your life.
Yep.
Well, again, we talked about normalizing a little bit in the last podcast.
Yep.
And I think people will do that even with this.
Yes, they do.
People tend to normalize things where other people have large pores. I have large pores. It's okay. The thing is, there are ways to treat pores, and we can go into a lot of different things, how aggressive or, how minimal you want to do it, but there are ways to be able to do it. And you saw in the Visia with Halo. Yeah. Great treatment, starts to minimize the pores, shrink them down, make everything much more suitable and not so noticeable. So it's not like you look in the mirror and the first place your eye goes to pores, It doesn't have to be like that. And so, again, I think the thing is taking a proactive stance on a lot of these things and saying, hey, I'm better than that. I don't have to have that. I can do something about it. And the nice thing is we can actually show what percentage improvement you get. Yes. So, if and it counts, it'll count. So you have X number of pores. Yep. And when you go to pores, it actually circles them. Yeah. So it not only shows the dot as to where it is, but the bigger ones get circled. You can really see where it is. And so we do have specific treatments that will actually kill the pore, so to speak, and make a big difference for those that need the more aggressive treatment. And then there's a lot of treatments that are just, will reduce the pores and shrink them down by creating collagen and elastin and tightening up the skin. So, and that's an aging process too. Yeah. Well, and you know what? Number 1, it starts with home care. It's just like any laser treatment we're doing, any anti-aging treatment that we're doing. We always talk with patients of, you have to wash your face, you have to use your products, you have to wear your sunscreen. Believe it or not, sunscreen is one of the top things. If you Google what to do at home for your pores, they're going to tell you to wear sunscreen. Number 2, if you're an oily person, you need to use water-based products because the more dehydrated your skin is, the more oil you produce. That becomes one of those catch-22 things where oily people are sometimes like, I don't want to put anything on my face. Everything makes me feel oily. If you are not attracting water to your skin and you live in a desert environment like Larry and I, you will actually dehydrate the skin so much that it will produce excess oil to combat that.
you will make your face oily, possibly cause more breakouts, and create larger pores. So you have to use some kind of water-based, oil-free products on your face. And then there's the home care treatments of things like Retin-a, can be excellent for pores. There's the alpha and beta hydroxy acids, things like glycolic acid, salicylic acid. Really, those home care products need to be, evaluated for you with a skincare professional, because some of them are going to be good for you, some of them are going to be bad for you. Every skin type is so different. So I always just throw out there, number one, you have to do home care. And the funniest thing is when I was doing research on this, one of the top things for reducing pores was washing your face twice a day.
And how many people don't do that?
It's shocking, actually, with just the way we do consults and things like that. And I get women in their 40s and they're like, well, I don't really wash my face at night. And I'm like, you're sleeping in that makeup? Like, come on. It's shocking. It's the same shock that I got when COVID first came out and the percentage of men and women not washing their hands when they left the bathroom. Mm-hmm. Yep, that's the same shock that I get to find out how many people do not wash their face.
Well, years ago, it was pointed out to me that I was using soap
in
the shower.
I was thinking the same thing.
On my face. Bar soap.
No.
So, I'm doing my body and everything, and then one of the girls pointed out, so the soap that you use to wash your butt, you're using on your face.
Yep.
And, it's like, you didn't have to say it like that. I mean, really, it's okay.
No, it's not. No bar soap on the face.
Yeah.
I am adamantly against bar soap on the face. I'm sorry, any companies out there that have bar soap for the face, it is a no for me. Things live on that. You can increase acne production. And most of the time, those bar soaps have a very basic pH, and we need acidic pH for the skin. So.
Yeah. The other thing, too, is, most facilities, if you go to a skincare type facility, they will have specialized product. Mm-hmm. I mean, we have product for oily skin. We have it for dry skin. If we have acneic patient, we will have oil-free. We will have different things depending on the situation.
Yes.
And I think that's important, too. If you're going to do cleanse your face twice a day, you're going to maybe moisturize, you're going to do certain things, do it with the right product. So the key is that you're doing something.
Yes.
But I think there's enough options. There's wonderful options out there nowadays. Yeah. So make sure you look into that and do something with it.
Well, you're brushing your teeth twice a day to take care of your teeth. Why are you not washing your face twice a day to take care of the largest organ in your body known as your skin?
Well, that was a personal problem of mine for growing up, for a long time. My dad would always wash his face. My mom would, but I couldn't see the need in it.
Oh, my gosh.
I was busy, I was a young, adolescent, I'm busy with lots of things. And why do I need to do this every night? I don't quite see the benefit, It's later you find the benefit.
Yes, absolutely.
So.
And then the next step for that some people will dive into is they will choose to do something like chemical peels. So maybe they start with the skincare if it's not enough for their pores. They'll do facials, they'll do chemical peels, they'll do microdermabrasion, they'll do dermaplaning. I think these can be very good options for some of our younger population who has very mild pores, very minimal issues, that they start preventing them from getting worse. They're cleaning out that excess oil, and they're doing mild treatments. And we don't really do a lot of chemical peels in our office. I'm not opposed to them in the right situation. But for us, we focus more on the lasers, where we're dealing with more of the true correction. Now people have these large pores. How do we get them corrected? And then we're going to maintain them with skincare. And so we have two routes we're going to go with this. We're going to go our laser route, and we're going to go our RF or radio frequency route. So the first one we're going to dive into is laser. And we're going to talk about some of these different laser treatments that are out there. Even though I have laser genesis listed first, or laser toning, we'll talk about that in a second. Larry, tell us what a PDT is.
That stands for photodynamic therapy, and it is something that I used to teach years ago, where you use a product called Levulin. Mm-hmm. PDT, that's what it was, and that stands for 5-amino-alevulinic acid. Your body actually naturally produces it in the synthesis of hemoglobin, and you apply it to the skin to clean skin. So the skin is literally acetoned.
Yes.
So we scrub it multiple times with acetone to get all the oil, everything off the skin. Then you apply Levulan to the skin, and it goes down into the skin like a little Pac-Man, and it attaches to anything abnormal.
Mm-hmm.
So bacteria, anything, but like enlarged sebaceous glands, it really focuses on that.
Precancerous.
Precancers, things like that. So it'll attach to it, and when it attaches, it gets converted to PP9, which is protoporphyrin 9, which is very light sensitive.
Yes.
And so now you have all these little Pac-Men that have gone down, attached to things that you really don't want in your skin, and it's just sitting there. And so the longer you leave this on, the more abnormal things get attacked.
Yeah. The
So
more
it's just-
dramatic your effect is going to be.
That's right. So then you add light to it, blue light typically, and you add some blue light to it. And the longer you do the blue light, the more aggressive. The longer you leave it on before the blue light, the more aggressive. And then it will literally, so like blue light, you could lay under the blue light all day and have a little bit of heat, but not much. With this, you are on fire.
Yeah, you want to die.
Yeah.
You need two Zimmers blowing negative 35 degrees, cold air on your face, and you're still hot as hell.
Yep.
Like it is out of control.
Yeah.
So after
It's head in oven. You
Yeah.
know, just think of that. It's really, really hot.
I don't know, I think it's a head in a fire.
In a fire. Okay.
The oven doesn't even cut it.
Okay.
So they have to put this chemical on. They have to wear it all day or sleep in it overnight. They have to come into the office. We have to put them under this blue light. We have to light them on fire, like the hottest you have ever been. And then they have to go home, Larry. And what happens over the next week?
You really look hideous. You know, and
I wish we had the photos of you when you did this.
I've done it three times.
Yeah, 3 times.
And
But it was before camera phone times.
yeah, it's insane.
So what happened to your face?
Especially on the last time, I did some insane things with it. But I have never had acne. But when I did that, I had acne everywhere. So I had pustules all over my face. And it's like, if you've never had that, you go out of your mind. It's like, what the hell?
It's not only pustules. It's like pustules on pustules on pustules.
Yeah, yeah. And
Like
so,
every pimple has 3 other pimples on top of it.
yeah. And so I'm sitting there squeezing them.
Which you're not
And
supposed to do,
yeah,
by the way.
I have a mirror. I can't take it anymore. It's like, this is horrible. I got to get rid of it. And so then they take the mirror away and things like that. But it's just, so that's the way it is for about 2 days, 3 days.
Yep.
Maybe 3.5. And then things start to calm down. You don't see that so much. And then on usually about day 5, day 6, you peel. Your whole face comes off.
Yeah.
And your skin is left really looking nice.
Yeah.
It is
Red, but nice.
Red but nice. And it is a chemical peel. It's one of the few chemical peels that has been shown to really stimulate the production of collagen.
Yeah.
And so, you know, around your eyes will get tighter, your skin gets tighter, all of this. And so it's a safe treatment. It's just an uncomfortable treatment.
Yep.
And we've done it many, many times for acne.
Yes.
And, you know, because the choices, and we've had some podcasts, I think, on acne
Yeah.
and stuff. Some of the choices we don't like.
Yeah.
And this is not systemic. This
No.
is localized to where you use it.
Yeah.
And we have, when patients come in and they have had multiple things cut out, you know,
Cancer-wise.
yes, they are ideal. That's an
Yeah.
ideal candidate for Levulan. They do it once, you know, usually that's all it takes. And a lot of times a dermatologist will do this. They tend to do it for an hour or 2.
Yeah.
We tend to be much more aggressive. And then they'll do it, you know, 3, 4, 5 times. But how they get paid and all that is a little bit different. And the price of the product has gone up substantially. So
Well, and besides that, the reason why we've shied away from doing a lot of these Levulan treatments is patients don't want to go through the downtime.
Yeah.
You know, for the severe acneic patients, they're willing to do it. They're just like, get this off my face. When we see those like grade 4 cystic acne, this can be an excellent option with no systemic side effects like the way some of the drugs have. Now, for our patients who have large pores, this is kind of a severe thing that you have to go through to get rid of those large pores. So luckily for us, technology has advanced. Because I'm not going to lie, I have chickened out. I have never done a Levulan. Even though I hate my pores, and Larry's tried to talk me into it a couple of times, I just cannot do it.
It's real simple.
No, I don't want to do it.
I'll do it.
I've been resurfaced, and I still chicken out for the Levulan. So there's other lasers, and one of the first ones that came out was what we call laser toning. So this is using a 1064 nanometer wavelength. There's 2 different types. There's our long pulse 1064, and there's also our shorter pulse or the Q-switch lasers, which I used to love that. So now this is a very minimally effective. Again, my younger clients with not a lot of issues, I love doing the laser toning on them. It's going to tighten their pores. If you have a Q-switch laser, which is a tattoo removal laser, and you have not figured this out yet, doing 1064 on people who have really severely impacted blackheads will literally shoot them out like a worm. It is so much fun. The first time I did it, I kind of freaked out for a moment. I was like, oh my gosh, is that supposed to happen?
So how we have fun at our office, yeah, now you know.
Yeah. But you get these younger kids in who have that horrible acneic skin. Again, this has no downtime, no pain. It can really clean out their pores for them without all of the extractions and all of that issue. The problem with this is it's not a long-term correction. It's more of an immediate where I would do laser toning on like brides and mother of brides and before proms and things like that. Because you do several of them, it gets you looking really good, very short term. You know, and most people can't afford to keep coming in every week or 2 weeks or even every month for one of these treatments. So people needed longer lasting things. And, you know, I want to briefly bring up, because with the PDT, photofacials can go with that. And photofacials overall in the long run help with pores, but not as much as some of the other technology we're going to talk about.
Well, you know, a number of years, radio frequency started to become very popular. Mm-hmm. And they used it on the body, they used it on the face, different things. And they started to realize you can do radio frequency through needles.
We're not there yet, but that's okay.
Oh, am I jumping ahead?
Yes.
Oh, well, I love to get ahead of the program.
He is right, though. I did tell you guys all that we are going to talk about radio frequency. That is probably the newest thing that's out there. But before we get into that, we need to talk about, we're not done with lasers yet.
Okay.
So resurfacing. So Larry, tell me about what the halo is.
So halo uses 2 different wavelengths. One puts a hole in the skin, and the other is energy that goes deeper into the skin to affect collagen and tightening and things like that. So the hole itself allows you to introduce the energy deeper, but it also, you know, helps to smooth skin.
Yes.
So anytime you're putting holes in skin, you know, that's being replaced with new skin, right? And so that's going to give you a nice look, and for texture and things like that, I think that's a nice improvement. But again, if you can go down, and we talked about halo and you saw the photos, you saw the before and after for pores. Wonderful. I mean, what a great treatment. You know, you can do this treatment, minimal downtime.
Minimal pain and discomfort during the treatment as well.
Totally different. You know, it's a nice treatment to be able to use for this type of thing where you're really trying to get that. And the advantage to halo is you really have a lot of, I mean, you could treat scars, you can treat all different things with it depending on what depth and what settings you use. So the system is very programmable for what you want to do and what you want to accomplish. And so if you're wanting to accomplish pores, you can put in settings that reflect good results for pores.
Yeah.
And so it's pretty straightforward. And depending on how bad someone is. So again, if you do a Visia and it's really, they have, you know, 950 pores on this side, and they have 1,200 on this side, and the nose has almost as many, you know, you're going to be pretty aggressive.
Yes.
Maybe the
Yep.
nose even has more. What the heck? Let's go for it. So the thing is, you can do stuff, and that's the idea. You can
Yes.
make a difference.
Well, and that's the thing. I feel like Halo was one of the biggest breakthroughs as far as having something that was extremely successful at long-term pore reduction without the pain and downtime of doing a PDT. Because some of this other stuff is maintenance. Your home care is maintenance. Your chemical peels are going to be maintenance. Your laser toning treatments are going to be regular maintenance, and it becomes extremely expensive. Halos have actually shown long-term reduction of pores for, anywhere from 9 to 12 plus months out. They, depending on how long they've continued to track that individual patient after a single treatment. Now, obviously, severe patients, like you said, are going to need more than one. Like this gentleman right here, this is acne scarring plus large pores. Even though they were treating scarring, the pores are almost completely gone as a side benefit to him. So that's a huge difference for you're talking about a 3 to 5 day of downtime. And I mean downtime as you look a little swollen and ugly and crusty brown, but you don't feel bad. You don't have any pain. You don't have any discomfort. You're just a little swollen and you have this crusty brown skin. So if you work from home, which during COVID has become a thing, it was super easy for patients to have this done. They come in, they drive themselves to and from the clinic, they get the laser peel, they don't need drugs or anything like that. They go home, they can work from home for the next 3 to 5 days and they're fine. So it's very, very easy to have done. And, it's funny because I love this treatment. I've had it done several times, but I think it was the second time I ever had it done. I don't always tell my husband when I'm doing stuff because he complains about things. So I come home with my face peeled from the Halo, and he's like, we have tickets to a comedy club tomorrow night with our friends. And I was like, well, I'll go. And he's like, you're going to go looking like that? And I was like, we have this makeup that is designed for post-resurfacing. A doctor created it. I'll just put the makeup on. I was so swollen and pumpkin head looking, and then I patted that makeup on, and to be honest, I don't care. I'm going to go. I don't care what other people think. His sister who was with us, we were laughing so hard in the bathroom because I was like, people probably think I really look like this. But I was like, nobody could tell. If they didn't know me, they didn't know I looked weird. They just kind of thought I was wearing a mask or something. But I wasn't in pain. I could still have fun. I just looked a little odd.
That tends to be what we do.
I know.
A lot.
Well, because we don't care when we go to work.
Yeah.
Our patients are excited. They're like, ooh, what'd you do today?
Yep.
And I've had a couple times where I've had a Halo and patients have come in. They're like, oh my gosh, your face. And I'm like, I'm so glad you reminded me because I was going to go to the grocery store after this and I forget that I look like this,
We have a treatment called Moxie, which is like a baby halo.
It is. It is a different wavelength. Okay. So Halo is 1470 near infrared and a 2940 erbium. This baby Halo Moxie is a 1927 near infrared.
And that's a diode, and it's similar but different.
Yes.
It's similar in how you deliver the energy. It's
yes.
All of that. It's not as aggressive. You can program how much energy and
yes.
how many passes you are doing.
Yeah.
What you can't really do is you can't program for scars.
Yeah.
That you're going to this depth, or that you're doing this, or you're doing that. So it's more of a minor treatment, but it's a wonderful treatment.
Oh yeah.
And it's kind of that in between treatment to just keep everything looking good all the time.
Yes.
Your face on day 2 and 3 kind of feels like sandpaper, and then it just comes off like dandruff on a black shirt. That's it. And it's easy. It's a really nice, easy treatment to do, and we think it fits well.
Oh, I love it. The last 2 times that I've done a Moxie, it's always at like 2 to 3 weeks out. I get tons of compliments on my skin from our patients.
Yeah.
Where everybody's like, your skin looks really good today. So I do love it. For me, it is definitely an excellent maintenance, excellent for this younger population where they don't quite need the full Halo. They don't really want to commit to as much downtime, but this is still going to change the way their pores look. And it's like, if they're young, if they're in their 20s, if they're starting with battling pores, they could probably do 1 Moxie a year. Not a big deal. Maintain it, and they'll never get to where these pores can get out of control and actually become so huge that you have to have them cut out.
Right. And for offices that are looking at technology, What a great technology.
Yeah.
I mean, it's simple, it's easy, your technician can do it, so it's delegatable to...
Patients don't need drugs or anything.
Yes, they
It's-
don't, just numbing cream,
Yeah.
that's it, you're good to go.
Although Larry told our first patient that she didn't need numbing cream, and that was a lot of fun. I was going second, by the way, so I was grateful to her. Partway through, she told me, "Go put some numbing cream on your face, or you're going to regret it."
Well, she's female, I figured she could handle it,
Oh
you
my
know.
gosh! I told her that later on I would get him back by not letting him numb and just do the Moxie to him.
Yeah, you should numb.
Yeah.
Okay, I'll admit it. But I'll tell you...
It's not that bad,
yeah,
though.
but
With a little bit of numbing cream, no big deal.
But for an office starting out,
Yeah.
what a wonderful treatment, because you can do your photofacials, you can do all that
Yeah.
with the system. It's a Cyton system. It's called the M-Jewel.
Mm-hmm.
Great system as a fantastic get-started program.
Yeah.
I think it's, amazing. So,
Yeah. Well, because the next step up from Halo and Moxie and things like that is just going to full-blown resurfacing. So whether you are doing a fractional CO2, a fractional erbium, or a fully ablative erbium, you can actually get rid of these pores. And before we had Halo, this is what we were doing, was laser resurfacing, either the micro laser peel, which is fully ablative, or the fractional to really break it up and go after those areas, which I did love. But once the invent of Halo happened, that 1470 wavelength along with the 2940 was more successful at getting rid of pores with less downtime. So pretty much all of our pore patients, I just automatically say, we're going to Halo. Like if that is your primary concern, I can still get rid of some texture. I can still do this. It's less downtime. Our patients that have a lot of sun damage, like when he was talking about the barcode on the upper lip and things, sometimes they need that fully ablative laser where we just burn their face off and they, skin grows back. With that, they end up with no pores as well. So, I mean, it does take care of it because it shaves down all that old dead skin that's building up.
So there are a lot of methods,
Yeah.
lots of things you can do, and we haven't gotten into RF yet.
You can cycle into RF right now.
So kind of the new kid on the block. I mean, lasers have been around for so many years. I mean, I was using a laser 25 years ago when I started in this. So it's changed. A lot of things have changed. And while we still love it, we still have all the lasers. We
Yes.
still use them every day.
Every day.
There's just an additional new technology by comparison, and that's microneedling with radio frequency. And there are different systems that do that.
Yes.
We have 3 different systems that are all needle-based,
Yeah.
and they all work. They all do some similar things, but there is some specialty, especially with the Agnes.
Yeah. So with the Agnes was actually invented by Dr. On for the purpose of selective sebaceous gland destruction. He was wanting to come up with a cure for acne that would not have systemic side effects like some of the drugs, and obviously that was easier to do than some of these things like the Levulon. So he developed this device. They're little needles of different depths that actually go straight into the pore, and they heat up and kill the sebaceous gland. So the sebaceous gland then dies. It's a before and after of a nose of doing the blackheads, which is one of the settings that's on there. And it just causes it to purge. So once you kill that sebaceous gland, you will get a mild purge, not to the same purge level of a Levulon. So this is the purging afterwards, where you can see as all the stuff comes out of that pore because we've killed that sebaceous gland, usually somewhere between 48 to 72 hours afterwards, they purge. And so with this device, we have 3 types of tips that go after it. We have B, which they've labeled for blackheads or what we use for large pores. They have I for inflammatory acne and C for comedone acne. So depending on what's going on with my acneic and my large pore patients, I can actually go in and close down a bunch of pores. Now it is a process because you can't close them all down at once. Number one, you need some oil on your skin. So we go in and close down about every 3rd one or the especially large ones. But with this, you'll have a mild downtime because again, you are going to purge. So we treat you and at 72 hours, we bring you back in. Unlike Larry, I tell my patients, do not pop it, do not poke it, do not touch it. You're going to come in at 72 hours and we will extract it for you. If it comes out when you're washing your face in the shower, you just let it come out. I don't want any squeezing, Q-tips, extractors, anything on the face, leave it alone. So it is hard for patients sometimes not to touch their face, but if they do it with us, they're less likely to create scarring or more damage or turn it into a more inflammatory issue by keeping their hands off their face.
And then after that period of time, they come in and we do it.
Yes, yeah,
So
the 72 hours.
We're basically doing it for them, and that just gets everything out.
But in a very clean, sterile environment where
Yeah.
we have gloves on. We've cleaned your face with hypochlorous acid. Like we're taking that, extra step to make sure you're not spreading infection.
Yeah. So that is one technology, and that same technology is used for lots of other things,
Yes.
depending on what needle you're using, what the issue is. And so we might do a nose lift on you using the same technology where you bring the nose up, but you can use the exact same technology to get rid of the pores.
Yes.
So the advantage to certain technologies is they have multiple purposes.
Yeah.
That's like Halo that we talked about. You can do multiple things with it. That's what's true with this device as well.
Yeah, absolutely.
Yeah.
And so that would be the first step to reduction in pores, is actually killing the pore itself, closing it down. The second version of, I always call this focused RF for me. So they're little needles that are very focused that emit RF to a certain level. The true RF microneedling, which we have 2 different devices, this would be the second step of RF where these are going after collagen production.
And so again, we talked about that up front. If you improve collagen production, and that's, we talk about at age 15 is your peak, at age 30 it's over. At age 16 you're dying, right? So your peak is 15. So
He keeps lowering that number. I don't know why you keep lowering that number.
So at age 7,
You're done.
So the fact is, things are going to change and lots of differences are made. And so we know you don't have the collagen. And what produces collagen? Fibroblasts. And fibroblasts aren't present like they used to, and you stop producing them as well. And so if you have a device that proliferates fibroblasts and that helps you produce the collagen, and everything gets better. So it's just a process.
Yeah.
And we like that process, and we use that process in almost every treatment we do to enhance the overall long-term outcome.
Yeah. And so basically, if you've had a lot of sun damage, if you're losing collagen, one of the easiest ways to keep stimulating collagen to minimize the size of pores is doing RF microneedling. I literally sell this to patients as like no downtime. Like you're going to be red that day. The next day, mildly pink. You can probably put makeup on. You're fine. Anytime I've had this, if I've had it that day or the day before, patients are like, really? You had a treatment just before? And I think we came in here when we did the rosacea podcast. I had literally had the treatment the night before in order to come in and do this podcast to show patients, unless you guys were looking closely to notice my slight redness, most people wouldn't have known that I'd had a treatment done the night before. So for me, I look at these as the regular maintenance. Everybody should be doing some kind of RF microneedling at least once to twice a year. It's safe for all the Fitzpatrick skin types. You can use it in pretty much any skin problem that's going on. So, and it's easy to have done without minimal downtime. If you've had some recent sun exposure, it's not a huge issue as well. So there's so many benefits to doing this. And that's why these devices in our office run all day long.
And we've done in the past, we've done some podcasts on these devices.
Yes.
And how I think on one of the recent podcasts, we talked about adding exosomes to it. And how we now do that as an automatic. If we microneedle RF your face, we're going to add exosomes, and that just promotes better healing and it promotes healthier skin. Everything that we want your skin to do will happen probably faster.
Yes.
And so it is a great way to add to that. But the idea of putting 25 little needles in your skin, adding heat to those needles the right way makes all the difference in the world. You know, the right depth, the right way. Are we trying to just tighten skin? Are we trying to lift skin? You know, and of course, if collagen is making a big difference in pores and pore size and what we look like, well, whoever gets the most collagen wins. If this device can do that, right? If this device can do that, we should be promoting it every way we can, and we use it a lot at the office.
Yeah.
Both devices going all day.
So this is basically how I rate my poor people when they come in, right? We have mild, we have moderate.
Poor people, you mean not rich, or you mean other poor people? Oh, I mean poor people that actually are walking around with these horrible pores.
Oh my gosh. I was not even listening to myself when I was saying that. This is how I rate my people with large pores on their face when they come in.
As opposed to the rich people who come in. All right.
So they have mild, they have moderate, they have severe, and then I put my extreme cases. So my mild cases, I usually tell them RF microneedling or Moxie. My moderate cases, I want to go to Halo. So at that point, it's definitely going to be a Halo. And every single one of these people, skincare is part of it. My severe patients, I'm doing usually an Agnes and a Halo. So we're doing a combination. And then extreme at that point, if it is super extreme, if they're willing to, I am going to try to talk them into a PDT or the traditional Levulon, because it gets so much done at once, they just have to suffer through it. If not, they are going to be multiple Agnes treatments and multiple Halo treatments, which I'm happy to do as well. But sometimes I'm like, if you just want to knock this out in one really big go, let's just get it over with. Otherwise, it's going to take me a little bit of time to get you where you want to be. But I kind of break it down for them in that, regimen of, depending on where you fall, we do these different things. And of course, everybody's, vision of how severe their pores are is so much different than what we actually see. So part of what the Visia does is helps us to analyze, where do they fall in that? Are they mild? Are they moderate? Are they severe? Are they extreme? And then we can judge.
And then they get to see it.
Oh, yes.
That's the key, is that, as a patient, when you visualize actually the size, how many you have, and all that, that can help in making, your determination where you want to go with it. The other thing that kind of makes a difference is your family.
Yeah.
Can they tolerate you coming home looking like Freddy Krueger's, night out? You have to really take that into consideration, because you have young children, you have this, you have that. So maybe a slower, long approach
is easier
that,
sometimes.
6 months, a year from now, problem will be pretty much solved.
Yep.
Versus, a couple months where we have to go a little more crazy.
Yeah.
So you take everything into account, and you look at, if you're in office doing this, what technology do you have?
Yeah.
What can I offer? If you have multiple choices, then you get to sit down with the patient and find out what's going to work best for them. We always say if all you have is a hammer, everything looks like a nail. So if you only have one device, there's not many things. It's like we have to do it this way.
Yes.
Having multiple devices gives you all these choices, and not everyone can start out having all the different devices. I understand that it is expensive.
Yes.
But you do need to take into consideration what's going to be best for that patient, their family, their lifestyle, and what will work for them.
Yeah, I agree. And that's where we are lucky. I try to remind myself of that. So we have all this technology. So when my patients come in, I can customize their plan for what they need for their skin. So that's been a huge benefit to us. But just over the years, the advancement of technology, at least now we have things that are very minimal to no downtime that can be done for people, instead of it just being one crazy treatment and that's your only option.
Correct.
So, all right, Larry, I think we're about ready to wrap up here. So any last words of advice for our patients?
All I would say about this is you really have to, we mentioned normalizing. We have to get away from that, because you're going to hate it later.
Yes.
Putting something off, not doing it is not a good thing. And we know that the likelihood of success is always based on how bad you want it.
Yes.
Well, if it's there and it's bothering you, let that be the impetus to do something and get it done, and get it done when it should be done, so it doesn't become a nightmare for you down the road.
Yeah.
It's so much easier for us to treat something that's not, at the horrible mark. Once it gets really bad, then, obviously we're either going to have to do a lot more things over a lot longer period of time, or do crazy aggressive, which we're all into, but it's not the best scenario for everybody. So,
I agree.
so
Well, I think that about wraps us up for today. So thank you all for joining us, and we will see you next time.